Dr. Kaler. Good afternoon. How are you? I'm good. And thank you so much for coming and spending a few minutes with us today. We do have been attending the post-print conference, which has been organized in the first time by 1Cell.ai. Are you enjoying the countries?
Absolutely. It's a pleasure to be here. And the topics, everything is designed and planned so well. And the interaction is so good. I'm absolutely happy to be here.
That's wonderful. So just we wanted to take a few minutes of your time to understand a little bit better about you and what you talk. So my first question, rather, is just to ask me what research is yourself to affiliation and also a little bit about your journey to how you became who you are.
Thank you. Thank you so much. I'm Dr. Amrit Kaur. I'm a molecular pathologist. I absolutely deal with the molecular oncology part of the cancers, and I'm specialized in cancer genomics and precision oncology. I started my journey just like other students at that time when everyone wanted to be just a doctor or an engineer, and I wanted to serve patients. So I definitely chose medicine, entered into pathology because I wanted to know more about the morphology part of it, the tumors into looking into makes what makes the morphology different. And then with time, I wanted to treat patients. I wanted to treat them better. But with the coming in precision oncology and the new diagnostic technologies, I understood that the cancer cannot only be treated with chemotherapy, but there are other ways of dealing it in a better form. And that was the time I chose that I want to get into molecular biology. I reported all those borders, types of cancers for 10 years. And after 10 years, I thought, no, it's time to know the biology and to understand how can we treat patients better. I understood all the technologies, the sequencing methods, what are the different types of mutations, what are the different types of methods which will help me detect those mutations. And with that, I got into the fellowship program of molecular biology of cancer genomics. And with that, I came out with the different diagnostic methods. So we started screening both solid tumors and hematological malignancies. And with time, we were able to stratify them, we were able to classify them, we were able to tell the prognosis of all these cancers, and also able to help patients understand their treatment options, which were very limited. So the patients started approaching us for different types of tests, like what test will work for them in stage 1, what will work for them for stage 4. And with that help, we were able to do the proper sequencing, because in India, cost is a very important factor. So doing the right test at the right time is equally important as we have the right treatment. So we started screening them with the proper test, which is applicable for that particular cancer. Because if it is breast cancer, we know that the mutations are important. But if I want to do sarcomas, I know fusions are important. So I need to apply that particular panel to 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 the right test. So with those results, we were able to help a lot of patients in stratification. And also with that, we started the precision oncology counseling unit. You know, with that, we were able to tell them that these are the options, treatment options, which are applicable based on your molecular biology. We were able to give them answers. And how is your tumor, how the tumor is going to behave? Is it aggressive, is it controllable? We were able to give them answers, and with that we formed a complete team. I work at Kokilaben Dhirubhai Ambani Hospital, and our oncologists, we have a team, and with our references, then they are being treated in our hospital in a very precise way. And with the way oncology is going, based on a molecular oncology, I think it's a wonderful way ahead. And I totally appreciate that we are able to change lives in a better form.
And that's one of the things this guy is mankind goes how we focus and other focuses. How do we help?
Yes. Yes. Yes.
Especially cancer, which is a disease that's proliferates just There's no day on it for staying in home. That's sometimes uncontrolled. We don't. The patient doesn't breastfeed yet, but it's their limits. So that's fantastic. So nice.
There is a lot of psychology concerned with it. When the patient when the patient has some answers, the amount of energy the patient gets, happiness the patient gets, the 50% he's already treated, and 50 they become so positive. Yes, that there is an answer, there is a way out, and with the result, the rest of the 50% happens by itself. So I think uh, I think that's a wonderful way of looking ahead of things.
So that's really, that's very touching is the insights. Thank you so much for sharing that. So in terms of testing at the component manager advantages, how do we feel about the so new technologies, including sort of right? New technologies are coming up from other companies too. How do you feel how these new technologies? And what do you think is the future for testing results actually?
Uh, Yes. First of all, I congratulate 1Cell Diagnostics for making this wonderful milestone in reaching at a point in which we are able to receive, services in the form of a liquid biopsy. I think they are pioneers in ctDNA and CTCs, and I really appreciate Jayant and Abhinandan in Aravindan in taking this forward. Uh, Definitely, the results, when I look at all other companies, the results which I see in the form of the ctDNA results, they are very, very precise to the point in which the clinical applicability is there. And I've seen the validations, the way they have done the sensitivity and the specificity. It's quite precise. So I usually prefer sending ctDNA and CTC test results to the 1Cell Diagnostics, and looking at the applicability, when it is being offered, it is still in the research for all the even the healthy patients and even cancer patients. In cancer patients, definitely it is used for monitoring and MRD. In healthy patients also, people wants to see, but with my experience, I've seen if the patient has a germline mutation uh, in a healthy patient, and if we apply this CTC and ctDNA in those patients after a particular age. So, I mean, if we have a breast cancer patient with BRCA1, BRCA2 positivity, the risk immediately starts after 30 years. And if we start applying such tests, screening tests for these specific patients, in which I know that the risk is 30 to 50% already higher, which is 5% of the average population, I think this is a way forward, in which we can prevent the cancer. So I think germline testing along with the ctDNA and CTC monitoring in such patients, I think will prevent a lot of cancers in this society.
Yes, from a testimony. That's awesome. And do you feel if you have the tools to be able to learn about it right now, let me hit on new technological developments for Western, the UK and the education that's done on the demonstration that's done by that. So are you happy with that? People.
Yes. I think 1Cell is doing a wonderful job, and the conference which has been arranged has given us a complete overview of the whole of the process which happens here, right from the library preparation to the sequencing, even to the interpretation of the bioinformatic analysis. I think uh, the knowledge is quite good and apt. And I think 1Cell should, go ahead and do all these conferences. And whenever I have a question on any of the reports and everything, I think the scientific affairs team, immediately gets back to us and gives us the results, and the questions are properly answered. So I think it's a good team there. And I'm very proud to be a part of that team. I consider myself that.
I want to thank you because being you more advocates like you, and you what if not this best way to communicate. So thank you so much, Dr. Keller. We really appreciate your insights. Yes, and your time today.
Thank you so much for having me.
On this. And we really look forward to you being able to translate the QC as a molecular pathologist, many more molecular pathologists Rohingya and immigrants by way of their populations, of communication, etc. In your experience.
Absolutely. Thank you so much.